Good afternoon, and thank you for joining us for our daily briefing in the fight against Covid-19. I'm joined today by Professor Steve Powis, Medical Director of NHS England. I'd like first to update you on the facts about the spread of the coronavirus. Then I will outline why it is so critical that we continue to observe the rules on social distancing. Thirdly, I'll explain what we're doing to increase the capacity of the NHS to deal with this disease. And finally, I want to say something about how we can all work together to defeat this invisible enemy. First, the facts as they stand today. As of 9 a.m. today, a total of 183,190 people have been tested, of which 41,903 tested positive. 15,073 people in England have been admitted to hospital with Covid-19 symptoms. But the pattern of hospital admissions in England and Wales has regional differences. In London, the number of admissions fell slightly between the 1st and 2nd of April. Admissions are steady in Wales, but in Yorkshire and the North East, they've gone up by 35%. And in the Midlands, the rate of hospital admissions has gone up by 47%. 708 people have sadly lost their lives as a result of Covid-19. The highest daily total yet recorded. And that means that of those hospitalised in the UK, the number who've passed away now totals 4,313. Those numbers emphasise again the importance of maintaining social distancing measures to halt the spread of the disease. More than ever, we must stick with it, as the Prime Minister said in his video message. Now, I know that life under lockdown can be challenging, and some will be tempted on this sunny weekend to venture out and about. But, as the Health Secretary underlined yesterday, if we relax our adherence to the rules, we increase the risk for others. That's why it's so important to stay at home, to protect the NHS, and to save lives. We need to think of those on the front line and the sacrifices that they're making for us, as the Chief Nursing Officer for England reminded us yesterday. Ruth May asked us to remember two NHS nurses who died after contracting Covid-19. Arima Nasreen, who was just 36, and Amy O'Rourke, aged 39. Each had 3 young children. They died while doing everything they could to help the sick and the suffering. We can all best honour them by playing our part in fighting the disease, by staying at home and slowing the spread. 7 healthcare professionals have now lost their lives to Covid-19, and we offer our heartfelt condolences to their grieving families and to the many others mourning the loss of loved ones. They include the family of Ismail Mohammed Abdul Wahab, who died aged just 13 in King's College Hospital in London. His mother and siblings are showing symptoms of the virus, and they were unable to say their final goodbyes at his funeral. In their despair, the loving, dignified tributes from Ismail's parents are truly haunting. Our thoughts today are also with the family of the 5-year-old child with underlying health conditions who's tragically died.
OK, well, let's get more on the government's response, ongoing response to the coronavirus pandemic, and we can talk to the Secretary of State for Health, Matt Hancock. Good to see you this morning. Look, we are, according to the experts, and it seems pretty clear from looking at the figures where we are now at almost 9,000, that we are hurtling towards hitting 10,000 coronavirus-linked deaths this weekend. That's really a horrific figure.
Well, look, my job as Health Secretary is to protect life. And this underlines how important it is for everybody to follow the social distancing rules and to stay at home, just as your reporter was saying there. If anybody thinks that it's okay to slacken up when it's clear that although there are signs of the curve flattening, which is good news, and we shouldn't throw away that good work of flattening the curve, but it's still clear that the virus is spreading in the community, and we've got to make sure that we stop that. And so people really do need to stay at home this Easter weekend.
Look, I know it has been made very clear throughout all the briefings that the government has been following scientific advice. That's understandable. You've got to rely on the experts. But nevertheless, do we think now, with a little bit of hindsight, that advice was not necessarily right, that we didn't take enough stringent action early on?
No, as you say, we followed the advice, and we also looked abroad at what was happening, and we made those decisions. I think the right decisions to bring in this lockdown at the right time. And what matters, and what I concentrate on every single day, and what we spend our time working on, is what is the best route now, and what should we be doing next. And the very clear evidence from what's happening, from if you look at the number of cases and the number of people going into hospital, what is clear is that the measures are working, but we're not there yet. And so people should take heart that the measures are working, because it is bringing this epidemic under control. But also be resolute in that we're not there yet, and so we need this to continue. And of course, we'll keep reviewing that advice, and the scientific advisory group are meeting next week. But for this weekend, the message is really crystal clear, which is to stay at home.
In terms of that messaging, I mean, you say it's crystal clear. I've got to say, from a personal perspective, I've not found it difficult to understand. But there are people who've said to me that the government has not been specific enough, and particularly when we're looking at last weekend, and no doubt we will see some of it this weekend, sadly, of people not really following the rules. Do you have to be even more precise and say, if you go out this weekend, go out for an hour tops, you must keep moving, you cannot sit down, you cannot have a barbecue, you can't sit down with a flask of tea, whatever it is? Do you have to be absolutely crystal clear on all that advice?
Well, I think we have been. I was asked last weekend whether it was okay to stop and have a picnic, and the answer to that is clearly no, because the reason that you can go out for exercise is to get exercise, and because of the very positive benefits that you get from exercise. So we have been crystal clear, as you say. The vast majority of people are following the rules. I'm also really pleased over the last week or so to see that the number of people following the rules, which we track, and the proportion, there hasn't been a slackening off. People are continuing to follow the very stringent rules, despite the impact that it has, and we understand that. I understand it. And so actually the amount of adherence to the social distancing rules is something that I'm very pleased about. Of course, I always want to see everybody following, and there is a very small minority who flout it. But actually, if you look at the figures, and if you look at the data that we use to try to measure these things, there is a very, very high degree of support for the measures and adherence to the measures. And so I want to thank people who do follow the measures. And then, of course, along with the police, we try to get that proportion increasing all the time.
There is some very confusing messaging, not from the government, but from all these sort of academics and things in all this, when we've been talking about a vaccine, because we heard only a week or so ago, some experts were saying a vaccine was going to be middle of next year. In the Times today, there's this article coming from a very high-ranking scientist in Oxford talking about the possibility, absolutely pushing us to the limits, but we might be able to get something into production by September. Clearly, you're across all the research and all the work that's going on here. What do you understand a realistic timetable to be?
Well, I am engaged in all of that, and I know quite a lot about the Oxford project, and it is really great to see some hope especially on the front page of the newspapers. But the way that I think about it is as follows. We will put all the resources we possibly can into getting a vaccine because of the massive benefits that we'd have to have a vaccine. We're also putting enormous resources into making sure that when a vaccine comes about, if and when, then we can manufacture enough here to be able to get it to everybody as quickly as possible, because it's not just about discovering the vaccine and then checking that it's safe, but it's also then about manufacturing it. And we have got vaccine manufacturing capability in this country, but it needs expanding. So we're doing that in parallel whilst we wait for the scientists to develop a vaccine that we're happy with. And then essentially to make sure that whatever the outcome of the science, however fast that happens, we are ready to get the regulatory approvals, ready to get the production, and ready to get it logistically to everybody who needs it. So in a sense, my job is not to have particularly to have a view on how fast that will happen. I think the truth is it's impossible to know, but it's nice to see some hope, as I say. My job is to make sure that as and when the scientists make their breakthroughs, and there's no way I could do the science, I leave that to them, the country is ready to step up, pick up the science, turn it into mass production and get it out, and that there aren't any barriers in the way, whether financial or regulatory or in terms of capabilities, to the scientists making the fastest progress that they possibly can.
But there are some barriers in place, aren't there? I mean, there's been a lot of talk about this plasma therapy in order to combat COVID-19. The government has not approved trials for plasma therapy. Why is that?
Well, if an individual clinician recommends it, then that can be used. And we are expanding the trials of different medicines, different therapies all of the time. In fact, we have one of the biggest trials program in the whole world going on in this country. For instance, you might have heard of hydroxychloroquine, which is much discussed. We have one of the biggest trials of hydroxychloroquine in the world. And in the same way that we follow the scientific advice on social distancing, so too, we're determined to follow the scientific advice and follow the science on making sure we get these treatments in, get them within a clinical trial so that we collect the data, we really understand what works and what doesn't work, what sort of dosage applied to which patients at what time, so that we can then learn from them and treat more people more effectively. So the one that you mentioned is something that I've seen and I know is available to the right people on the NHS where that's clinically appropriate. Those decisions for any individual patient, of course, have got to be made by the clinician who's treating them.
Look, I want to talk to you about PPE in just a second. Before we get to that, though, can we talk about the number of people on the front line who have caught and sadly passed away from COVID-19? I mean, what sort of figures are we looking at the moment?
Well, at the moment, 19 people have died from the NHS family. For them, it is it's a heartbreaking story, and I know that it affects everybody who works in the NHS to see their colleagues die. I think that the important thing is to work out to what extent people contracted it in the line of duty, so to speak. Because, of course, people can have caught it from all sorts of different reasons. And you mentioned PPE. We aren't aware of any link from shortages of PPE to any of these deaths. But my heart goes out to their families. And I've said already that I think the fact that such a high proportion also are from people who moved to this country to work for the NHS is really heartrending. To see people who've literally given their lives for the NHS, who moved here to give that service, and I think we should pay tribute to them.
Well, absolutely. I think everyone would agree with you on that. But in terms of the PPE, now I heard you in the news conference last night. I have to say, it did strike me a little bit. And no doubt it's a valid point to say, look, the PPE is here. There's a logistic issue. You're getting it around the 58,000 bases or whatever you mentioned today. But there has been, certainly reported on Twitter and elsewhere, a sense of anger in that you did say, however legitimate it may be, about saying, you only wear the PPE when you need to, only use the pieces that you need to. When you're on the front line, when you're actually dealing with this, perhaps you are getting through more PPE than maybe absolutely necessary, but we can't criticise people for doing that, can we?
No, and I won't criticise people for doing that, but I will reiterate how important it is to use exactly the right amount of PPE. As you say, that it's an important point to make because PPE is a precious resource, and we need to make sure that it's used appropriately, that everybody has it, that every single person gets it, which is why it's such a complicated logistical exercise, getting millions of pieces of PPE to the right person and to the millions of people who work across health and social care.
Can I mention something to you that I spoke earlier on, a couple of hours ago, to Dr. Julian Tang, who is an expert in these respiratory conditions and how they are spread. And he said, although PPE is very important, it was at the bottom of his sort of inverted triangle of the measures that you need to do to stop these sort of issues, particularly within hospitals and care homes. He said that actually ventilation was much more important, even using ventilation systems better, but also, literally opening windows can actually have a real impact on how this virus is being spread.
Well, I think there's a lot of wisdom in that. Of course, the top priority, the absolute top priority, is making sure that NHS capacity is always above the demand for it. I mean, one of the things that we've managed to achieve during this crisis is always ensuring that there's enough capacity in the NHS to treat everybody and give everybody the top class treatment that they need. So that's the absolute number one. Ventilators is clearly a part of that. Getting testing right is incredibly important. There's a whole program of work all the way through all the measures, and we've just we work night and day on doing the very best we can on all of them.
Can I finish off? I want to ask you about the lockdown. It's been well reported, and some experts have come forward and said, look, it looks like the lockdown will have to be extended. We haven't had that definite word yet. Don't we need that as soon as possible? We need to be told rather than having this waiting period of 3 or 4 days. We need to be told now, don't we, that this is going to be extended through to the beginning of May.
There's only one thing that matters when it comes to people making decisions about what they're going to do this Easter weekend. There's only one thing that matters for that. All the other discussion is important, and I'm quite happy to answer questions about it. But there's only one thing that matters in terms of what people do this weekend. And every single person can play their part in the national effort to defeat this virus by staying at home. That's what I'm doing, and that's what everybody should do.
I want to say
Secretary of State, good to talk to you.
Everyone who's gone the extra mile during this very challenging period. Thank you to all of those who are looking after us in our time of need, the NHS workers on the front line who have treated the sick, saved lives, and tended for those who sadly could not be saved. For the doctors and nurses who have died of coronavirus whilst caring for others, we will never forget their sacrifice. We will never forget their devotion to helping others. And I also want to say a big thank you to the carers, the charity workers, all those looking after, or even just keeping an eye on, those in their local neighbourhood. You are the lifeline to so many people in our communities. Thank you to the workers who keep the country running, the supermarket workers, the delivery drivers, the technicians, the cleaners, the public servants who just kept going, determined to keep providing the daily services that we all rely on. I think you've certainly made us all think long and hard about who the key workers are in our lives.
Day 1177 of the Trump administration, 200 days to go until the presidential election. The current president started this day wishing all Americans a happy Good Friday, perhaps because of the New York Times story last night saying Republicans were trying to get the president to talk less every day. Today's White House briefing went on for over 2 hours. The president said some of the coverage is fake news. He said today flatly, everyone has the ventilators they need. He said we're in great shape in every way. He said at a certain point it will be gone. It will be gone, he said, and it won't be much longer. He said there's not a lot of issues with testing and we don't need full testing. He talked about, quote, the death numbers, the numbers of death. He said at one point we're talking 50, 60, 65 maybe. What he meant was 50, 60, or 65,000 people dead, potentially. And on the topic of death, he issued his daily reminder of how bad it wouldn't have been had he not acted at all. That prompted David Axelrod to say the president was taking a victory lap on deaths. The president said staying at home leads to death also, maybe a different kind of death, he said. And about his campaign to reopen the U.S. economy, something ultimately up to governors and mayors and individual businesses, he said, I've got to make the biggest decision of my life. Quote, somebody said it's totally up to the president, and it is. He said the states can do things if they want, and he added he can override them. He said, I have great authority if I want to use it. Back in the real world, in our stay-at-home nation, the number of coronavirus deaths around the world today topped 100,000. There are more than 1.6 million confirmed infections now. In the United States, the daily death toll topped 2,000 for the first time. We set a new record for our one-day death toll. NBC News reporting over 18,000 people have now died from coronavirus. More than 490,000 are known to have been infected. That's an increase of over 30,000 cases in just this past day alone. And the outbreak continues to spread. The state of Michigan saw its deadliest day thus far, 206 deaths from the virus, though the president made a point today of saying Michigan is, quote, really doing much better than we thought. Earlier today, I asked Dr. Anthony Fauci about the latest death toll predictions for our country.
The most recent examination of the model with the new data that has been put in says about 60,000. I still think we can do even better than that. That's why I've always said, sometimes to the dismay of my modeling colleagues, that models are as good as the assumptions you put in, and you could influence those assumptions by real data. So 60,000 is where the model is saying now, but let's see, maybe we can do even better than that.
More of my conversation with Dr. Fauci coming up. As we said, Trump still has his sights set on reopening the American economy, as he puts it. And today he offered a preview of a new second government task force to get things up and running.
I call it the Opening Our Country Task Force, or Opening Our Country Council, so we don't get it confused with Mike's task force, which has done so great. And we're going to have the great business leaders, great doctors. We're going to have a great group of people. I do say this, Jim, I want to get it open as soon as possible. This country was meant to be open and vibrant and great, not where people are, staying. And
Are you determined?
No, I'm not. I would love to open it. I'm not determined anything. The facts are going to determine what I do. But we do want to get the country open. So important.
Here's the problem. The New York Times obtained government projections that warn of an increase in cases if restrictions are lifted too early. The Times reports it this way. Stay-at-home orders, school closures, social distancing greatly reduce infections of the coronavirus, but lifting those restrictions after just 30 days will lead to a dramatic infection spike this summer and death tolls that would rival doing nothing. Today, the president was asked how he'll go about deciding when to reopen the country.
Can you say, sir, what metrics you will use to make that decision?
The metrics right here. That's my metrics. That's all I can do. I can listen to 35 people. At the end, I've got to make a decision. And I didn't think of it until yesterday. I said, this is a big decision. But I want to be guided. I'm going to be guided by them. I'm going to be guided by our vice president. I'm going to make a decision based on a lot of different opinions.
President again insisted our country is doing tremendous testing for coronavirus despite shortages and backlogs in hard-hit New York. Governor Andrew Cuomo said antibody and diagnostic testings are needed on a massive scale to safely restart the economy. He also reported another devastating day for his state, 777 new deaths in just the past day for a total of more than 7,800 now. So far, there are over 170,000 confirmed cases in New York, again, greater than any country except ours. But again today, Cuomo included some encouraging stats.
We are cautiously optimistic that we are slowing the infection rate. That's what the numbers say. That's what the data suggests to us. Change in total hospitalizations is down, not relative to yesterday, but when it's averaged, the 3-day average on the hospitalizations, you see a dramatic decline in those numbers, and that's obviously very good news. Change in ICU admissions is actually a negative number for the first time since we started this intense journey.
The governor again stressed the importance of staying on course in all this social distancing we're experiencing. There were two other chilling numbers out of New York City. The NYPD has now lost 19 members to this disease. The department reported more than 7,000 uniformed members were out sick right now. That's roughly 20% of the department's uniform workforce. Then there are the chilling images, new video out of New York City of a trench being dug at the public cemetery on Hart Island to accommodate a dramatic increase in the number of unclaimed bodies. The cemetery receiving roughly the same amount of bodies per day that it used to receive each week. Mayor Bill de Blasio offered this sobering assessment of the past 7 days.
This is a week where we reached milestones we could never have imagined. 5,000 New Yorkers lost, so many more than we even lost on our worst day of 9/11. A number we literally can hardly imagine. And every single one of the people we lost, a human story, a family grieving. At some point today, we will get to the point of 100,000 cases that have occurred in New York City.